Hi everyone, this is Mr. Neil Writer, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope. That initial clip you saw there was taken with our other device, the iClearScope, and I'm now performing the procedure using our WAXscope, which is due to be launched very shortly. We're hoping to get it launched early this month. But there's just been a bit of a delay with everything else going on, strikes and supply chain issues, but we've just had an update today that we are looking good for early January 2023. If you are interested, please do email info@clearwax.co.uk and we should add you to our mailing list. So this is of a patient who attended with bilateral, fully occluding dark plugs of softish consistency earwax. We're just commencing with their left ear. I'm just performing microsuction using a standard Zollner suction probe, and I'm just trying to wriggle this wax plug out from the ear canal entrance because the plug was a lot larger than the entrance, and I've just managed and succeeded in doing so. At the end of the video, you'll see some still images of these wax plugs to give you some perspective of how large they were. Just some residual wax just at the roof of the ear canal. It's non-occluding, but it's very straightforward to remove. We're near the entrance, so I've just gone back in and suctioned that away. There is also a bit of wax on the inferior anterior canal wall laterally, just here. So again, I'm just going to hover over this. We're on the cartilaginous portion, so we can apply a bit of pressure here. If this was on the inner 2/3, the bony part of the ear canal, we would have left well alone because it would be really uncomfortable to apply pressure with the suction probe as we were there on the bony part of the ear canal. You're now going to see an image of the patient's tympanic membrane. It's a bit of a twisty ear, this one, but managed to get it centralized in view. You can see the light reflex there. So you can see got quite prominent anterior recess. This is the left ear, so I'm just going to adjust the focus. You can see how quickly we can adjust the focus. So with the WAXscope, you don't have to, you can if you wish, but once you've got the WAXscope in situ inside the ear, you don't have to push it further or in or further away or move your head closer or further. You just adjust the focus on screen, so it's really simple. So once you've got it, as I said, the speculum in the ear canal dilating and stretching open the patient's ear to gain access, you just keep the speculum in the same position and just with a single swipe of your finger you can adjust focus, and you can see how quick that was. This wax plug was a bit more impacted, so what I'm trying to do is just detach it from the side canal walls. So I've just been inferiorly, now I'm going to the roof, so superiorly and also anteriorly there. And I'm almost trying to roll this away, so we're going posteriorly to the back part of the ear canal. But I kind of realised I'm going to have to remove this. The quickest and most efficient way is using a Jobson horn. I think with the ear hook it might have just sliced through, so I wanted a bit more surface area, and that's what a Jobson horn provides you. And I'm just coaxing it into the ear. I've managed to get into the core of this wax plug, and now I'm slowly bringing it away. When you're bringing away an ear hook or Jobson horn, you've got to be careful that you're not embedding it too deep into the wax, because then you run the risk of the tip of the Jobson horn or the ear hook scraping along the bottom of the ear canal. Just a piece of wax that broke off there, so again it's just at the entrance. Once again to get the Jobson horn in and behind. And this is where the WAXscope is really beneficial. You're not just limited to performing microsuction. If you are an ear care practitioner, you do need to be trained and be able to use proficiently all the ENT micro instruments, because sometimes it's just not possible to remove wax with microsuction, and sometimes there's contraindications to performing it. So if a patient's got severe tinnitus or hyperacusis, for example. Lovely view there of the eardrum. We're going to have another view of that in a moment, but again it's just a flake of wax just posteriorly. I'm just going to quickly go in with the Jobson horn, just manipulate this away. So I'm just getting it in focus, and I'm just going to rotate the Jobson horn, and that was actually on the bony part. You can see the difference between the bony part and the cartilage portion of the ear canal. The bony part's a bit more pinker. It's a very thin layer of skin there that lines the bony part of the ear canal, less than 0.1 millimeters in thickness, whereas the cartilaginous portion is thicker, it's a bit more paler in colour, and you've got a thicker layer of skin which is about 1 millimeter in thickness. Again, just visualising the patient's eardrum again. You can see a lovely view. They're the wax plugs, and I've just placed beside them the Zonda suction probe tip and the Jobson horns for some comparison perspective. I hope you enjoyed that video, and once again, if you are interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.